This is Real News Media TV, coverage you can trust. Please like, share, subscribe, and hit the notification bell. Select all for daily news updates. Prisoner escape Portland police lockup. The Port Antonio police have launched a manhunt for Mark McNeil, otherwise called Bunny, of Vane Road, Port Antonio, who escaped police custody on Sunday. Reports are that about 4 a.m., McNeil evaded officers while he was being treated at the Port Antonio hospital. He was in custody for housebreaking and larceny. The police are appealing to anyone with information on the whereabouts of McNeil to contact the Port Antonio Criminal Investigations Branch at 876-993-3183, the police 119 emergency number, Crime Stop at 311, or the nearest police station. Meanwhile, the police are reminding members of the public that it is a criminal offense to harbor fugitives. Bustamante Hospital suspends some outpatient services. The Bustamante Hospital for Children has suspended some outpatient services due to an increase in COVID-19 cases among staff. More than 60 health care staff are unable to work due to COVID-19. Health Minister Dr. Christopher Tufton says the hospital staff are under pressure. Services are under stress. They have had to convert some of the regular wards into COVID space. It also means that persons who are non-COVID are not able to be treated. We have had to cancel some 10 clinics. We appeal to the public, those who have had to experience the cancellation of clinics, to please bear with us until we can resume some sense of normality, the health minister said. The situation is further compounded by a surge in the number of children infected by the virus. The hospital has recorded 23 pediatric cases of coronavirus. Time for Commission of Inquiry into State Corruption, says De Aguilar. The Floyd D. Aguilar-led People's Anti-Corruption Movement says it has written to Prime Minister Andrew Holness demanding a People's Commission of Inquiry into state corruption. Also demanded in that letter is the need for a People's Forensic Audit of the public debt in order to determine which government members of Parliament and/or public officials may have benefited from state corruption. The Prime Minister chose not to respond to our letter, and so did the Leader of Opposition Mark Golding, who was sent a copy, and his support sought for such an inquiry, De Aguilar said in a statement. The MPs on both sides of the House of Parliament were also sent copies of these letters, and none has responded. Does this not confirm, therefore, the Gleaner editorial's claim that we have two gangs operating in Parliament? And if true, why has the police not used the anti-gang legislation to investigate and arrest as they do with other suspected gangs such as the Klansman gang now being tried in court? De Aguilar questioned. According to De Aguilar, it is estimated that millions of dollars are stolen from the public purse each year. This has greatly affected the proper funding of healthcare, education, and certain aspects of social infrastructural development, he said. He stated that we need a People's Commission of Inquiry into state corruption to ascertain the depth of the corruption and to expose those who are involved. We need a forensic audit of the public debt to determine which public officials or politicians may have corruptly pocketed the people's money. The people should not be required to pay back corrupt debt, he said. Holness dismisses reporters' question about a return to lockdown measures to curb COVID spread. Prime Minister Andrew Holness on Sunday was flippant in his dismissal of a reporter's question about whether he would reconsider his position of argument done and reinstitute lockdown measures to help curb the sharp rise in COVID-19 cases that are now overwhelming hospitals and healthcare workers. Holness was asked the question on Sunday morning during a Jamaica House media briefing where he announced the imposition of a zone of special operation in South Savannah-Lamar in Westmoreland, which has been in the throes of gang violence for a number of years. It was pointed out to the Prime Minister that the country's positivity rate has now topped 60% and hospitalizations are up during a relentless fourth wave of the coronavirus, driven by the highly transmissible Omicron variant. "Do you still hold to the point that argument done?" the Prime Minister was asked. "You've said it, thank you," was his response, which came at the very end of the media briefing. Of note is that some countries with much higher vaccination rates than Jamaica's, which is roughly 20% of the population fully vaccinated, have in recent times reinstated measures to help curb the rapid spread of the virus. But Holness has since last November noted that new lockdown measures will not be countenanced, instead urging Jamaicans to take personal responsibility by taking one of the available vaccines. While his administration takes steps to further open up the economy, the Prime Minister did extend by 2 weeks until January 28 the 10 p.m. to 5 a.m. curfew, while retaining the other protocols as acknowledgement that COVID-19 cases were on the rise. However, some doctors have been calling for the government to go further and reimpose a tighter curfew. On Saturday, the Jamaica Medical Doctors Association made a plea for health facilities to commence operating in emergency mode, given an overburdened healthcare system with understaffed and sick doctors as a result of the surging COVID-19 cases. The association has also requested an urgent meeting with the Health and Wellness Minister, Dr. Christopher Tufton, to discuss the way forward. In a statement on Saturday, the JMDA said that while there was an increase in the number of individuals seeking care at health facilities, there was also a large number of junior doctors who are in isolation or quarantine due to the high levels of exposure from caring for patients with COVID-19. As a result, it said there was an island-wide disruption in the association's ability to provide adequate patient care because they are understaffed. Those who remain on the ground currently are getting sick and are suffering from burnout. It is impractical for us to be expected to run clinics, wards, operating theaters, and all emergency units on a vastly reduced staff cohort, the association explained. We are thus requesting that health facilities commence operating in emergency mode. The JMDA will always prioritize the well-being of our junior doctors whilst ensuring that we efficiently carry out our duties in a safe work environment, the JMDA said. 2 men charged for robbery at Red Stripe. 2 men have been charged in relation to the robbery at Red Stripe on Spanish Town Road in St. Andrew last month. 32-year-old truck driver Christopher Rose of Greenwich Town, Kingston 13, and the 23-year-old security guard Hudson Skyers of West Albion in St. Thomas were charged on Saturday with robbery with aggravation, illegal possession of firearm, warehouse break-in, and a conspiracy to robbery with aggravation. Their court date is yet to be finalized. The police report that between 1 a.m. and 2 a.m. on Sunday, December 26, the men allegedly entered the premises, tied up a security guard who was on duty, and gained access to the warehouse. They reportedly stole 1,440 cases of Red Stripe beer and a Dragon Stout before leaving. The theft was valued at approximately $8 million. The men were arrested following an investigation by the police. Fire at Charles Gordon Market in St. James. Firefighters from the St. James Fire Department are probing the cause of a fire that destroyed 3 shops at the Charles Gordon Market in Montego Bay, St. James this morning. Preliminary information from the fire brigade is that the blaze started sometime after 10 a.m. at a cook shop on the premises, which was not in operation at the time. According to the acting superintendent of the St. James Fire Department, Winsome Grant, 3 units from the Freeport Fire Station responded to the blaze. 3 shops were destroyed and they were constructed of plywood with zinc roofing. They include 1 cook shop, 1 clothing store, and 1 building which was used as a storage or storeroom. Plus, there was partial damage to a section of the roof of the main building, which was made of concrete with zinc roofing. 1 stall and 7 hand carts were partially destroyed, said Grant. The damage is currently estimated at $3 million. 1,968 additional COVID-19 cases, 8 more fatalities. Some 1,968 additional COVID-19 cases have been recorded in Jamaica, increasing the tally to 112,218. Of the new cases, 1,135 are women and 833 are men, with ages ranging from 9 days and 95 years. The tally of active cases now stands at 13,696. A total of 7,600 tests were conducted. The parish breakdown is as follows: St. James 534, St. Catherine 386, St. Anne 293, Kingston and St. Andrew 271, St. Elizabeth 78, Trelawney 76, Hanover 76, Westmoreland 74, St. Thomas 64, Clarendon 41, Manchester 39, Portland 20, and St. Mary 16. Meanwhile, 8 more deaths have been recorded, increasing the total to 2,530. The Ministry of Health and Wellness said the deaths occurred between September 1, 2021 and January 13, 2022, and 2 more fatalities are under investigation, moving that figure to 378. In the meantime, there were 95 more recoveries, increasing the total to 67,142. Some 446 persons are in hospital, with 87 being moderately ill, 41 severely ill, and 7 critically ill, and 25,980 persons are at home in quarantine. Don't forget to like, share, subscribe, and hit the notification bell. Select all for daily news updates.